The most important thing to know right now, while we're in the midst of a widespread respiratory virus pandemic, is that air quality can be a contributing factor to respiratory illness and death, and can exacerbate pre-existing conditions or viral infections like coronavirus. It's really right now one of the biggest environmental risks for early death, and it can be responsible for as many as 5 million premature deaths each year. So it's really important to have a general understanding of air quality and how it's affecting your health.
Philadelphia typically is in the top 25 most ozone and fine particle polluted cities and regions in the nation. And it's a combination of pollution that we generate within our city and within our region, but also contributing factors include, power plants in the southern United States and the Midwest, and that pollution blowing with prevailing wind patterns into our region. So, top 25 most ozone and fine particle polluted cities in the nation, according to the American Lung Association. We have some of the worst air quality in the nation.
The PES refinery was the single largest contributor to air pollution, the single largest point source contributor to air pollution in the city. And so by the closure of the refinery, we can expect 470,000 pounds of toxic air emissions to not be released into the air every year. That is huge. Those are the kinds of toxic air emissions that we're talking about when we think about the impact on cancer, heart disease, and asthma.
And we know that Latinx communities have disproportionately high rates of respiratory illness and other diseases, all which poor air quality can contribute to. Even things like diabetes and heart disease, like Marilyn said. We know that the Latinx community, many times, these pre-existing conditions aren't often addressed in primary care, so this can lead to more preventable hospitalizations and, in the end, more severe health outcomes. And the Latinx community also disproportionately experiences high rates of preventable hospitalization, and the ability to manage these health risks is often limited by language barriers or immigration status and things like that.
I think that there have been some preliminary studies that have shown that in populations that where the air pollution is worse, they have worse outcomes of COVID. And I believe that the epidemiologic study that was done by Harvard showed that there was an 8% increased risk for death in those experiencing just a 1 part per million increase in air pollution. And although that certainly needs to be replicated, and we need to really understand that with a lot of other data, I think that we're going to see that air pollution, just as it can contribute to other upper respiratory conditions, certainly will be playing a worsening role for COVID.
Right? It seems like a huge problem with great impacts on our daily lives. And I think it's important to remember that as individuals, we can do things to control or reduce at least a portion of that exposure to air pollution, and do things to, one, reduce air pollution, but two, protect our health from some of those aspects. We can't control all of it, but there are some things we can do to control our exposure to some of those aspects to what we're breathing in.